Have a nice day. Let's continue from when we finished in the last lecture of the anti-emetic. We reached the classification of anti-emetic. We talk about the approach for the treatment of emesis through receptor antagonism, and this is achieved by anticholinergic or H1 antihistamine antagonist or neuroleptics such as D2 blockers or 5-hydroxytryptamine, 3 antagonist or a neurokinase receptor antagonist. The adjuvant treatment for the antiemetic include dexamethasone, benzodiazepine, and nabilone and dronabinol, which is the cannabinoid derivative. The receptor antagonist for histamine H1 antagonist. Here we get H1 antagonist, which is cynarzine, cyclizine, and promethazine. They are effective against nausea and vomiting arising from many causes such as motion sickness or GI irritation. None of them are effective against chemoreceptor trigger zone directly. Let's get to the slides. Let's get to this slide. We see for the chemoreceptor trigger zone, we have dopamine, 5-hydroxytryptamine, opioid, and substance P. So we don't have an antihistamine as a factor. So this is effective against the GI irritation or the vestibular system. And not effective against chemoreceptor trigger zone. Also, we have promethazine, which is one of them. One of these drugs, as antihistamine antagonists, have anticholinergic side effect used for treatment of motion sickness in a pregnancy. When there is no reserve, it's the drug of choice for treatment of motion sickness in a pregnancy. Also, it is used for treatment of motion sickness in astronauts. The side effect includes drowsiness and dizziness, dry mouth, and other side effects associated with antihistamine. Beta-histine, it is also an antihistamine, have a complicated effect, not as H1 antagonist, but also have an antagonism of H3 receptor and weak agonist effect on H1 receptor. So it's antagonize H3 and agonist for H1. It's used for treatment of motion sickness, nausea and vomiting, and associated with vertigo and Meniere's disease. It's a drug of choice, one of the drug of choice for treatment of motion sickness or vertigo. Vertigo and nausea associated with vertigo. Muscarinic receptor antagonist, we have scopolamine, not an butylhyoscine bromide, because hyoscine crossing the blood-brain barrier, but the unbutyl bromide not across the blood-brain barrier. So it's an anticholinergic. Let's get to the slides, to the classic slides. Let's get to see here. Blood-brain barrier, we have muscarinic. So we ought to cross blood-brain barrier to reach this center. So hyoscine N-butyl bromide, which not cross the blood-brain barrier or cross the blood-brain barrier, to low extents is not indicated for treatment of motion sickness, while the hyoscyamine or scopolamine, it's drug used for treatment of motion sickness. Also, dicyclamine may be used. It's employed for the prophylaxis and treatment of motion sickness. It may be administered orally or used as a patches. Its common unwanted side effects include anticholinergics such as dry mouth, blood vision, drowsiness. It's less sedative than antihistamine and poor central nervous system penetration, but still it's better than the an bromide when compared with an butyl bromide. And hyoscine and butyl bromide is less than hyoscine for the penetration of central nervous system, but still it's not fully penetrate the blood-brain barrier in the brain. This is the explanation of these notes, but it may cause drowsiness or irritation more than an hyoscine butyl and hyoscine and butyl bromide, which is the common name spasmine or buscopan. 5-hydroxytryptamine receptor antagonists include granisterone, ondansetron, tropasterone, palonosterone. These are particular valued in the preventing and treating nausea and vomiting associated with the chemotherapy and radiation, also post-operative medication. The primary action of these on the chemoreceptor trigger zone. Let's get the classic slides we deal with. Chemoreceptor trigger zone, we have 5-hydroxytryptamine. Also here we have 5-hydroxytryptamine 3. So it's act on the chemoreceptor trigger zone and act on the GRT or pharynx, activating the vomiting center. So it's used for the treatment of nausea and vomiting. The primary action is the chemoreceptor trigger zone. They may be given as injection. There is an injectable form of this drug. And unwanted side effects include headache, GI upset, which is the relative common side effect is the headache, while the gastric upset is relatively uncommon. The dose is 4 milligram in the each ampoule or 8 milligram in the each ampoule. Also, we have 4 milligram in ampoule or 2 milligram ampoule, and oral tablet or 4 to 8 milligram, and suspension. Also, we have solution. Also, we have a granisterone, which is 1 milligram IV, or tropasterone. Dopamine antagonist. We have antipsychotic drug such as chlorpromazine, perfenazine, prochlorperazine, and trifluoroperazine. They are used for treating more severe nausea and vomiting associated with cancer, radiation therapy, cytotoxic, opioid, anesthetics, and other drugs. This is act on dopamine D2 receptors. They can be administered orally or parenterally. They have side effect, which is include oculogyric crisis, maybe occurred, and from these drugs. Also, they act on many other receptors. They act on the dopamine. Also, they work on the histamine and muscarine. The common side effect including sedation, oculogyric crisis, and tardive dyskinesia. Other antipsychotic drugs such as haloperidol are relative compound of droperidol and levomipramazine. They act on dopamine D2 antagonist and can be used in the treatment of chemotherapy. But nowadays, in chemotherapy, we use as first line ondansetron or its family, which is 5-hydroxytryptamine in adjuvant with dexamethasone, and this is reserved for more severe cases due to side effect. Chlorpromazine, which is in the trade name large-acting, this name means large-acting anti-emetic, antipsychotic, antihistamine. That's one of a drug used in this line. Also, we have a neurokinin receptor antagonist. Also, we have a neurokinin receptor antagonist, which is the aprepitant and fosaprepitant. These drugs, sorry, let's get the notes clear here. Uh, these drugs These drugs act on substance P. Substance P cause nausea and vomiting when injected in IV, causing the release of gastrointestinal vagal effect on the afferent pain, causing nausea and vomiting in the stimulation of nausea and vomiting center. Aprepitant block substance P in neurokinin 1 receptor and the chemoreceptor trigger zone, causing regression of the vomiting occurred from chemoreceptor trigger zone. Fosaprepitant, it's a prodrug of aprepitant, which is administered intravenously. We have fosaprepitant and aprepitant and fosaprepitant. These two drugs used for treatment of nausea and vomiting. The first drug given, which is aprepitant, which is used in the treatment of cancer due to work of neurokinin. This we have an adjuvant antiemetic, which is the synthetic cannabinoid also, which act on the chemoreceptor trigger zone. The antiemetic effect is antagonized by naloxone, which employ that opioid. As we said, the adjuvant antiemetic, one of them is cannabinoid, which is the nabilon, found to decrease vomiting caused by agents stimulate the chemoreceptor trigger zone. Naloxone, which is opioid antagonist, uh, antagonize the antiemetic effect. It's given orally for the nabilon, and we have a half-life of 120 minutes, 2 hours, and excreted in urine feces. This is important in case when we are dealing with a patient with urinary insufficiency or hepatic insufficiency. The unwanted side effect, including drowsiness, dizziness, or dry mouth, postural hypotension may be frequent. Some patients, including experience hallucination psychosis reaction, resemble the side effect of cannabinoid, which is one of the most concern with these drugs. We have also high-dose corticosteroid, which is dexamethasone, can be used to treat emesis as adjuvant, which can be used as adjuvant in the treatment of nausea and vomiting associated with the cytotoxic drug or severe trauma. The mechanism till now is not clear, but commonly dexamethasone used as adjuvant with other anti-emetic drug, and the main side effect is drowsiness and anti-parasympathetic effect when used with the hyoscine, nabilon, or dystonic reactions such as metoclopramide. General CNS disturbances with the nabilon is seen and headache and gastrointestinal tract upset, which may be rare in case of ondansetron usage or other 5-hydroxytryptamine uh, antagonist. This is the condition and this is the drug which used for treatment of certain condition. For the motion sickness, we have hyoscine cyclizine. For the nausea and vomiting due to cytotoxicity, ondansetron, dexamethasone, aprepitant, metoclopramide, and this is one option of the treatment. Also, we have metoclopramide, dexamethasone, diphenhydramine, and benzodiazepines such as lorazepam. This is another treatment options. Nausea and vomiting due to other drug, including chlorpromazine or metoclopramide. Post-operative nausea, post-operative nausea and vomiting on ondansetron or metoclopramide or vomiting in pregnancy include doxylamine, dicyclovine, pyridoxine. Pyridoxine, some studies said that it has a role, and the other said it's a placebo-like effect. Meclizine and metoclopramide. And also, ondansetron can be used in treatment and of nausea and vomiting during pregnancy. It's sometimes preferred than metoclopramide due to oculogyric side effect, which is also called extrapyramidal side effect. The usage of histamine H1 receptor antagonist, including motion sickness, vestibular sedative for the vestibular disorder, and promethazine can be used in pregnancy. For the morning sickness, muscarinic receptor antagonists such as hyoscine for motion sickness. We have D2 receptor antagonist such as prochlorperazine for nausea caused by uremia, radiation, gastrointestinal irritation, severe morning sickness, and pregnancy. Or metoclopramide can be used for vomiting by uremia, radiation, and cytotoxic drug, and domperidone is less reliable to cause CNS side effect as it penetrates the blood-brain barrier poorly. So metoclopramide is preferred in case of irritation to the vomiting center and the medulla. Ondansetron and other 5-hydroxytryptamine receptor 3 antagonists used for treatment of nausea caused by cytotoxic drug or post-operative treatment. Cannabinoid can be used also. Till this slide, we finished the anti-emetic. The other part of our lecture is the prokinetic. We finish in the part 3 of anti-emetic. Thank you for your listening. Thanks a lot. Goodbye.